A non-governmental organization, AIDS Healthcare Foundation, and other civil society organizations have urged world leaders and the federal government to step up commitment to meet the $18 billion Global Fund target. The organizations made the call in Abuja at a civil society forum on the 7th Global Fund Replenishment Conference. Mr. Dozie Ezechuku, the Executive Secretary, Country Coordinating Mechanism for the Global Fund Nigeria, said the fund's support to Nigeria had left an indelible mark in addressing HIV, tuberculosis, and malaria.
Inception in 2002 till date, cumulatively, we've received close to $4 billion from the Global Fund. Currently, in the current cycle, which is usually 3 years, 2021 to 2023, our total portfolio or envelope or grant, if you like, is cumulatively for HIV, tuberculosis, and malaria, as well as COVID-19, is around $1.2 billion, yeah, which we are still using to support malaria, TB, HIV, and COVID-19, as well as health system strengthening program in the country. So our warehouses in Lagos and Abuja, the big ones, were taken to the international standard, state-of-the-art standard by Global Fund support, of course, with the U.S. government support as well. And currently, we're also investing in similar warehouses in 12 states and additional 9 states, in the country within this cycle too.
Ms. Kemi Badamosi, AIDS Healthcare Foundation Director of Advocacy, Policy and Marketing, African Bureau, said the foundation has rolled out a series of advocacy towards the 7th Global Fund replenishment for September 19 in 13 countries.
For us, because we have seen the impact of the Global Fund over time. We have seen the millions of lives that it has saved, whether it's on HIV, tuberculosis, malaria, which are three diseases that actually continue to affect a lot of people, including heavy burden countries like from here in Africa, like in Nigeria. That even the Global Fund was able to expand beyond just HIV, TB, and malaria to even support COVID response in a number of the countries, particularly resource-strained countries. And that goes to demonstrate that with the right support, with the right funding, Global Fund is able to do more for communities. We've seen even here in Nigeria, we're one of the, if not the biggest recipients of the Global Fund, but we see that we're able to put more people on treatment, we're able to get more people tested, we're able to ensure that we can find TB cases and even address issues around malaria.
Ms.
Because
Judith
of the support of the
Head
Global
of Programs,
Fund. So for
Education as
AHF,
Vaccine,
advocacy
and NGO,
around
said civil society organizations play a vital role in advocating for support towards the Global Fund replenishment.
Very, very impactful role. Since the coming of civil society, we can practically see that there have been lots of improvement in terms of their skills, in terms of holding the government accountable, in terms of advocating for the right thing. We have different CSOs who are handling different strategies and different thematic areas, and in each of these thematic areas you would find out that it is important that they work in hand with them so that they can reach out to those populations that are under those thematic areas.